Your liver is one of the most important organs in your body. It performs many vital functions, such as filtering toxins from your blood, producing bile to help digest fats, and storing glucose for energy. However, your liver can also be damaged by certain foods that can cause inflammation, oxidative stress, or fatty deposits. In this video, we will discuss 13 foods to avoid to keep your liver healthy and prevent diseases such as cirrhosis, hepatitis, or liver cancer. So let's get started. 1. Alcohol. Alcohol is the most common cause of liver damage in the world. It can interfere with the normal metabolism of the liver and increase the production of harmful substances that can damage the liver cells. Excessive alcohol consumption can also lead to fatty liver disease, alcoholic hepatitis, or cirrhosis. The recommended limit for alcohol intake is no more than 1 drink per day for women and 2 drinks per day for men. 2. Sugar. Sugar is another major culprit of liver damage. It can increase the level of triglycerides in your blood, which can contribute to fatty liver disease. Sugar can also cause insulin resistance, which can impair the function of the liver and increase the risk of type 2 diabetes and metabolic syndrome. The recommended limit for sugar intake is no more than 25 grams per day for women and 36 grams per day for men. 3. Salt. Salt can increase the blood pressure and fluid retention in your body, which can put extra strain on your liver and kidneys. High salt intake can also worsen the symptoms of liver disease, such as swelling, ascites, or portal hypertension. The recommended limit for salt intake is no more than 2,300 milligrams per day for adults and 1,500 milligrams per day for people with high blood pressure or kidney disease. 4. Fried foods. Fried foods are high in fat, calories, and trans fats, which can increase the level of cholesterol and triglycerides in your blood and cause fatty liver disease. Fried foods can also generate harmful substances called advanced glycation end products, which can cause inflammation and oxidative stress in your liver and other organs. The recommended limit for fried foods is no more than once or twice a week. 5. Processed meats. Processed meats are meats that have been cured, smoked, salted, or preserved with chemicals such as nitrates or nitrites. These chemicals can increase the production of nitrosamines, which are carcinogenic compounds that can damage the DNA of the liver cells and cause liver cancer. Processed meats can also be high in fat, salt, and calories, which can contribute to fatty liver disease and obesity. The recommended limit for processed meats is no more than 50 grams per day. 6. Red meat. Red meat is a good source of protein, iron, and zinc, but it can also be high in saturated fat and cholesterol, which can increase the level of cholesterol and triglycerides in your blood and cause fatty liver disease. Red meat can also contain heme iron, which can increase the production of free radicals that can damage the liver cells and cause inflammation and oxidative stress. The recommended limit for red meat is no more than 500 grams per week. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us and let us know what kind of content you want to see more of. 7. Dairy products. Dairy products are rich in calcium, protein, and vitamin D, but they can also be high in fat and lactose, which can increase the level of cholesterol and triglycerides in your blood and cause fatty liver disease. Lactose can also be difficult to digest for some people who are lactose intolerant or have a lactase deficiency, which can cause bloating, gas, or diarrhea. The recommended limit for dairy products is no more than 2 to 3 servings per day. 8. White bread, rice, and pasta. White bread, rice, and pasta are refined carbohydrates that have been stripped of their fiber, vitamins, minerals, and antioxidants. They can cause a rapid spike in your blood sugar level, which can increase the demand for insulin from your pancreas and impair the function of your liver. They can also increase the level of triglycerides in your blood and cause fatty liver disease. The recommended limit for refined carbohydrates is no more than half of your daily carbohydrate intake. 9. Soft drinks. Soft drinks are loaded with sugar, artificial sweeteners, and additives that can increase the level of triglycerides in your blood and cause fatty liver disease. They can also cause insulin resistance, which can impair the function of your liver and increase the risk of type 2 diabetes and metabolic syndrome. The recommended limit for soft drinks is no more than 1 can or bottle per day. 10. Caffeine. Caffeine is a stimulant that can boost your energy, alertness, and mood, but it can also have negative effects on your liver. Caffeine can increase the production of cortisol, which is a stress hormone that can cause inflammation and oxidative stress in your liver and other organs. Caffeine can also interfere with the normal metabolism of the liver and increase the level of toxins in your blood. The recommended limit for caffeine is no more than 400 milligrams per day, which is equivalent to about 4 cups of coffee. 11. Spicy foods. Spicy foods can add flavor and variety to your diet, but they can also irritate your stomach, esophagus, and intestines, which can cause acid reflux, heartburn, or indigestion. These conditions can increase the pressure in your abdominal cavity, which can affect the blood flow to your liver and worsen the symptoms of liver disease, such as varices, bleeding, or encephalopathy. The recommended limit for spicy foods is no more than once or twice a week. 12. Grapefruit and grapefruit juice. Grapefruit and grapefruit juice are rich in vitamin C, fiber, and antioxidants, but they can also interact with certain medications that are metabolized by the liver, such as statins, antibiotics, or antihistamines. This interaction can increase the level of these medications in your blood and cause side effects such as muscle pain, liver damage, or kidney failure. The recommended limit for grapefruit and grapefruit juice is no more than 1 serving per day, and only if you are not taking any medications that are affected by grapefruit. 13. Mushrooms. Mushrooms are a good source of protein, fiber, and vitamin D, but they can also contain toxins that can damage the liver. Some mushrooms, such as Amanita phthalates or deathcap, are highly poisonous and can cause acute liver failure or death. Other mushrooms, such as Agaricus bisporus or white button, can contain hydrazine, which is a carcinogen that can cause liver cancer. The recommended limit for mushrooms is no more than 1 serving per day, and only if they are fresh, clean, and cooked. These are some of the foods to avoid to keep your liver healthy and prevent liver diseases. By following a balanced diet that is low in fat, sugar, salt, and alcohol, and high in fiber, fruits, vegetables, lean protein, and healthy fats, along with other healthy lifestyle habits, such as exercising regularly, avoiding smoking, limiting alcohol intake, and managing stress, you can protect your liver and improve your overall health. Remember to consult your doctor before making any changes to your diet or taking any supplements that may affect your liver function. Stay healthy. Thanks for watching.